Shri Bhanu Pratap Sharma ji, the Secretary, Health and Family Welfare, Government of India. Shri Jagdish Prasad ji, DGHS, Health and Family Welfare, Ministry of Health and Family Welfare, Government of India. Additional Secretary, Shri C.K. Mishra ji, who is also the Mission Director. Shri Rakesh Kumar ji, the Joint Secretary in the Ministry. Shri Sikdar ji, Shri Tejram ji, distinguished members on the dais. Here present the development partners, BMGF, UNFPA, USAID, PFI, DFID, eminent doctors, NGOs, members of the civil societies and stakeholders, members of the print media, electronic media and print media, and dear friends. It is indeed a matter of great happiness for me, and it gives me immense pleasure to welcome all of you to the National Summit on Family Planning. When I see such a large congregation of health experts who are engaged and who will engage themselves for the next 2 days and deliberate on the issues related to the improving of the reproductive health, I really feel happy to note, and I'm confident that the deliberations which will take place in the next 2 days is going to give us the right type of vision which is needed so that in the reproductive child health care we can go forward and we can reach the targets. We all know that on April 7th is the World Health Day, and we are celebrating it as a Health Week, which started yesterday when we started a very serious discussion with the stakeholders on the e-health authority. Yesterday itself, we also discussed with the health ministers of the state about the launching of the third phase of Indradhanush, Mission Indradhanush, and the micro-planning part. How do we go forward? What are the gaps which has to be fulfilled? A detailed analysis was done. And today, I am happy that in this summit, you are going to discuss about the family planning issues. And with the valuable contributions of the stakeholders, we'll be certainly getting the benefit, gaining a lot, and would like to implement all those issues which you raise and which you suggest to us. We all know that in the past 1 century, the population has been on an increase, starting from 23.8 crore in 1901 to reaching to 1.21 crore in 2011. We have also seen that the TFR in 1947 was 6, and with all our interventions and with all our programs, we have tried to bring it to the stabilization level to a larger extent. Population stabilization, we know that family planning program we started in 1952. But in population stabilization and the national population policy came into existence in 2000, where we planned that in 2045, we will stabilize the Indian population. We also know that in coming times, in 10, 12 years, we are going to overtake China as far as population is concerned. But we are not disturbed, we are focused, we are strategizing in the right direction, and we plan that by 2045, we will be able to stabilize the population. There are some problems which we know, there are some challenges which we have to address, but at the same time, we are optimistic that with all your active support, we'll be able to achieve our targets. India at this stage is also going through a transition stage. The demographic transition is taking place. We have been able to reduce the death rates And we have been able to considerably reduction of the death rates. But so far as the birth rate is concerned, it still remains a challenge. And that we have to see to it that how do we go forward in that direction. I am happy to share, you all know, that at least 48% of the Indian population is now reaching the stabilized 2.1 level of stabilization. But there are states where the TFR is between 2.3 to 3 and 3 plus. These are the focus states and these are the focus districts where we have to concentrate. And that is why we re-strategized ourselves and we said that we have taken out 184 districts from various states where we want to see that we focus accordingly. And if we are able to focus in these 184 districts, we will be able to stabilize and bring the TFR level to 2.1%. That is what we plan to do. If we talk about the lowering of the fertility rate, the focus states have got some challenges. The challenges is low literacy, poverty, lack of timely access of appropriate healthcare facilities. When I talk about lack of appropriate health facilities, this is one area which we want to address. And I'm happy to note that NHRM has done a very good job with the support and the cooperation of the states that we have been able to address and see that the manpower and other facilities are provided to them. We know that for child survival and to reduce the maternal mortality and see the maternal health of the mother, increasing age of marriage, postponing the birth of the first child, which we saw in the IEC programs, the birth intervals, women's empowerment, literacy, and anti-poverty efforts, these are the important detriments for stabilizing the population. And it is a holistic approach which we have to take. We have to see to it that we empower the women. We have to see to it that poverty is addressed. We have to see to it that literacy is addressed. We have to see to it that not only the mother, not only the pregnant women, but the whole family has to be sensitized about these issues. We are going in that manner and in that way. With all your support, we'll be able to reach the desired goal. We have transitioned from the target approach to target-free approach. NRHM has been a very important instrument in bringing this change. And because of that, we have been able to give them the facilities which are needed. Drugs, diagnostic, other interventions, surgical interventions, whatever has been needed, that has been provided. Even the manpower, the drugs and the diagnostics part. We have gone a paradigm shift as the family planning has emerged as the key strategy to reduce the maternal and the child mortality and morbidities. We have gone for a continuum care program. We have gone for a life cycle approach program. It is not only to reduce the population. It is not only to control the birth rate. It is to take care of the mother, the child, the health of the mother, the health of the child, and also to see to it that the procedures which go through, that has to be supported by the Ministry of Health and Family Welfare. So continuum care and life cycle approach has been adopted. I am very happy to share with you that RM and CHA is giving very good results. We are taking care of the mother the day she becomes pregnant. From that very point till she delivers the baby, we take care of the health of the mother. And after that, when the baby is born, we take care of the baby for the next 2 years by giving the vaccination, which has been increased from 7 to 11 now. And we also see to it that when the child reaches the adolescent age, all types of supplementation are to be given to the child. So it's a life cycle approach which we have developed. India Newborn Action Plan, the programs for encouraging institutional deliveries, for encouraging for helping them in surgical procedures there in the institution. These are some of the very important things, providing them transportation from bringing them to the institution and taking them back. If their complication develops, even then intervening. All these aspects have really helped us in decreasing the maternal mortality ratio and the infant mortality rate. So we have been strategizing and seeing to it. All this has led to a situation where in the last decade, the decadal growth has, the decadal growth rate was from 21.54% in 1990 to 2000, has been reduced to 17.64% in 2001, 2011 and 2010 and 11. 65% reduction in the maternal mortality is something very great, very important. In 1990, it was 65%. It has been reduced to 65%, whereas the global reduction is 47%. So I'm happy to share with you that as far as the maternal mortality is concerned, the performance of India is better than the global performance, and we have reached the 65% than 45%, which is the global pace. But still, lot is to be done. Our secretary has been talking about the interventions which we have done, the postpartum family planning program, the IUCDs, and how do we go forward in that direction. We have been encouraging, and we have got a very good reception. But yes, the focus states it needs to be re-strategized, because there we are not getting the responses how much we need. There may be issues. It is an issue of culture, it is an issue of literacy, it is an issue of poverty, it is an issue of lack of information, whatever the issue may be. But yes, this is one area which we need to address. And I am happy to share with you again that approximately 17 lakh postpartum IUCD insertions have been done. The same way, we have also enhanced the basket of contraceptives, injectables, then centochromon and POPs. These have been added, and we have seen to it that the contraceptive options are increased, and we have increased the basket, and we are trying to go forward in that direction. Your field experiences can give us really much more insight so that we strategize and re-strategize. Because here, all stakeholders are here. You have got your field experiences. You have got your feedbacks. You understand the hard realities at the ground level. So your inputs is really going to help and see to it that we go forward. We have gone for very good IEC material. Just now you saw how 6 or 7 types of pledges we have taken, and how we have tried to focus issue of the husband and the wife, focus issues related to mother and the child, focus related to mother-in-law and the daughter-in-law, and we have tried to focus the family issues. So IEC material is there, we have to use it. One thing I would like to certainly request all of you is that these IEC material should be properly utilized. I don't say that it goes waste, but I certainly have a question whether it is rightly utilized or not. I come from a field, I have a field experience. I see a lot of literature lying in PHCs and CHCs in dump, not being properly distributed. So it becomes a wastage of money, it becomes a wastage of energy, and whatever we plan here is not disseminated in the right perspective. So I request all of you to see to it that these valuable materials should be disseminated through ASHA workers, through A&M workers, and it is rightly displayed. Yesterday, I saw one of the very good the CD that was prepared, that was developed for one of the health programs. Then I questioned, how do we effectively use this? The effectivity has to be taken into consideration. And as C.K. Mishra ji was talking, that we have to strategize, we have to maximize our efforts We have to synergize, sharpen our efforts, and we have to sensitize people. I think if in the next 2 days, if we work in that direction, so that we can focus our strategies, if needs minor changes to re-strategize, we do that. The Government of India is open to new ideas. We are open to new ideas. Your experiences will be well taken care of. But if we maximize, if we synergize, our Secretary Bhanu Pratapji was talking about the private parties, the private players. We have to take them on board. Approximately 70% of the healthcare is with the private players. And what we can do with them, how do we go forward? How do we engage them? How do we bring them into the fold so that we work together in synergy and give the effective results? That will be a very good step, which I feel. In the end, I would like to give a commitment to all of you that the Government of India is committed for accessible, affordable, quality health care, and all eagerly and very proactively interested in seeing that the population stabilization takes place before 2045. We have been doing good in MDGs. We have to keep a track in SDGs, and with all your support, we will do it. This platform is going to generate many new interesting ideas for which Government of India will be eagerly awaiting to implement it. With these words, I thank you all for giving me a patient hearing. Thank you very much.